Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations. Seems like we've been doing this for too long. Today is October 27th, 2022, and I don't think we're done with COVID, although I think we're making good progress. So again, if you have questions, please send them to Facebook questions at douglaspublichealthnetwork.org. We have one good question that I'll try and answer a bit today about the use of ivermectin. So in the world, COVID is pretty flat. Not seeing a lot more new cases, but there are two developments which are a little worrisome. One is an increase of disease in Northern Europe, so in Germany, France, and England, where they're starting to see an increased amount of disease and an increased number of hospitalizations and an increased number of people needing mechanical ventilation. So not only is the disease increasing, but the severity is also increasing, and that's a bit of a worry. And then we're also worried about Singapore. So Singapore is just a tiny little city, really one of the most remarkable places in the world. I visited there about 40 years ago, and it's really grown a lot since then. But it's a city-state in Indonesia, and they've done a very good job with COVID throughout. But they're really struggling with a bunch of disease now due to a vaccine variant, a vaccine-resistant variant. So this is an Omicron variant, which is not well controlled by the vaccine. So they're seeing, although people have had the disease before and they've had the vaccine before, they're continuing to have new disease. Now, it doesn't seem to be high severity, but they are having lots of cases. In the US, cases are still going down. In Oregon, cases are flat. In Douglas County, cases are flat or going down. However, we've still had about 5 or 10 people a day in the hospital, some of whom are pretty sick, and we've had 2 deaths in the last 2 weeks. And when we look at those people in the hospital, look at their history with the disease and their history of vaccinations, it's very striking that the people who get hospitalized have generally not been vaccinated or not been boosted, or if they've been boosted, got boosted a year ago. We also note that the people in the hospital haven't taken advantage of the Paxlovid, which seems to be very effective. So again, to prevent hospitalization, the best thing you could do is to get boosted. And if you get the disease, then to go ahead and talk to your provider about using Paxlovid or for the monoclonal antibodies. But there's a bit of a worry in that the newer variants that we're seeing may be less well controlled by the monoclonal antibodies. You remember the first monoclonal antibody was the Regeneron, which worked great against Delta, but that does not work well against Omicron. So there was a new monoclonal that came up called bebtelovimab, which did work well against Omicron and has continued to work well. But with some of the newer variants that we're seeing, the BF and the BQ, it doesn't seem to work. And there's not a new monoclonal on the shelf or in the pipeline. So we're worried that as we get to these new variants, we may see disease that cannot be controlled by the monoclonal antibodies. The good news, however, is that Paxlovid does seem to work even against the newer variants. But again, the vaccine has been really effective. The booster vaccine has been very effective. New study that came out from Israel, which really looks for complications very well, showed that the myocarditis that we worried about was rare and not very serious, and no deaths. Everybody fully recovered, and the myocarditis was much less likely from the vaccine than it would be from getting the disease itself. So again, if you were nervous about getting the vaccine or nervous about getting your kids the vaccine because of the myocarditis, I think this is very reassuring that you can go ahead and get the vaccine and be safe. One of the questions that came up this week was about the use of ivermectin. So ivermectin is a parasitic drug. Early on, it was thought maybe to have some effect against COVID. Early on, there was some quick studies done in different parts of the world that suggested it might have a good effect. But I think now we've had 5 consecutive studies, well done, large populations that show it really doesn't work. The most recent one that came out looked at people who had mild to moderate disease and used ivermectin as an outpatient. It really didn't make any difference. So again, I think the increasing amount of data is showing that ivermectin is not of much use. But the Paxlovid does seem to be useful, and the monoclonal antibodies, at least currently, seem to be useful, although we're not sure that when new variants come out that they'll remain as useful as they've been. Another question came out as well. What's this RSV thing that I've been hearing about on the news? So RSV is a disease called respiratory syncytial virus. It's a nasty germ. It's been around as long as I've been a pediatrician, and sure many years before that. So it affects mostly the very young and the very old. So unlike COVID, which affects the old but not the young very much, this one affects both the young and the old. It comes through every year, and usually comes through the Gulf states and the East Coast starting in November and December, and then makes its way to Oregon in December and January. And we usually have our peak season between January and March. Babies, especially preemies, when they get this, really get sick. Their lungs get so full of this debris from the respiratory syncytial virus that they cough, cough, cough. Some wind up in the hospital, some wind up intubated. Thankfully, there are not very many deaths because mechanical ventilation works well, and it doesn't seem to affect anywhere in the body other than the lungs. And so it is a serious disease. The babies who have this tend to have really troubles eating, and they cough and wheeze for many weeks and months after they have the disease. So RSV is terrible. In older adults, it causes a pneumonia-like syndrome. And again, it mostly stays in the lungs. So not very many people die of this, but a lot of people get sick and wind up in the hospital for a reasonably long period. So the concern is with this fall that if we have a moderate amount of COVID, a moderate amount of flu, and a moderate amount of RSV, that's really going to overload our hospitals. And our hospitals are already pretty full now before we have much RSV, before we have much flu, and before we have much COVID. So our concern is that come another month or two down the line, if we start seeing more of this, it could really overload our hospitals. And that's one of our biggest fears. Because I remember what the hospital was like last summer. I remember it was like this spring when the hospital was so full that people who needed other routine care had a hard time getting it. The hospitals were very full and had to curtail other schedules. So we are worried about what's going to happen. So what can you do? Well, there's probably not much you can do to avoid RSV. There's no good vaccine for RSV, and it does spread. Again, what we usually see the way kids get it is older kids get a mild cold, bring it home to their baby brothers or sisters, and that's when they get sick. So again, our advice along this, if you're sick, stay home, is going to be good advice. For flu, again, it's transmitted in a respiratory way, so staying home when you're sick is good. But also the flu shot can definitely decrease your risk of getting the disease and thus spreading the disease. And then the COVID booster can also tremendously decrease your risk of getting severe disease. Now, you still might get mild disease, but severe disease that's going to clog up the hospital, put you in the hospital, are things that can be prevented with the booster. The bivalent booster is now widely available. There's a clinic this afternoon and tomorrow up at the old Colorcraft building. And then most of the doctor's offices have it now. Almost all the pharmacies have it. So please go ahead and get your bivalent booster. Again, when we look at our people in the hospital, almost none of them have availed themselves of the booster. So please go ahead and get this bivalent booster. It'd be great to get it sometime in October or early November so that you get good protection. In terms of when it's best to get the flu shot, if you knew when the flu wave was coming, it would be 6 weeks before the flu wave. It's probably going to be coming in January or February. So I would again suggest October, November, the absolute best time to go ahead and get the flu vaccine. So again, we're in a pretty good state with the disease now, but I'm expecting that come November and December, we're going to see an increase in the amount of disease. And that's going to make a lot of people sick, and it's going to really stress our healthcare system. So do what you can. So again, our recommendations haven't changed very much in the last 6 months. Get vaccinated, and if you're eligible, get boosted for both flu and COVID. If you're sick, stay home. If you're sick, get tested for both influenza and flu. If you're positive for influenza or flu, talk to your provider about one of the antiviral drugs. So the Paxlovid works great against COVID, and the Tamiflu works really pretty well against flu. So if you are positive, talk to your provider about whether you'd be a good candidate for one of those treatments. And again, those treatments are both widely available. They're relatively inexpensive. So please go ahead and get that and stay well. In terms of wearing masks this fall, masks, there's a new study that came out that showed that masks really do work. Now, it's a little late, but it showed that the consistent use of masks really work. And again, that shouldn't be surprising. I mean, we wear masks in the hospital when we're around bad disease. We wear masks in the OR. We know that people who are around TB who wear masks are protected. And so this should come as no great surprise that masks work. And so if you want an extra degree of protection, certainly wearing a mask when you're out, especially in crowded situations, is really your choice, and you should feel good about doing it. There's still a rule in Oregon to wear a mask in medical facilities, and that's probably a good idea, at least through the winter. So stay well, get vaccinated, get boosted if you can. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County. Thank you.